Are you thinking about choosing physiotherapy as a career in India, or are you confused about the scope, the growth, and stability? Every year, thousands of students choose physiotherapy as a career, but most don't know the reality, the salary, the competition, the physical strain, and the growth. Hi, I'm Dr. Prerana and today I'm going to give you a honest guide about choosing physiotherapy as a career. We're going to talk about the scope of practice, the areas of practice, the urban versus rural scope of practice of physiotherapy, and who should not become a physiotherapist. I will also be sharing a very personal story of my experience of being a physiotherapist in India. For eligibility, you should be choosing PCB, that is biology as a subject in your 10th and 12th standard, followed by which you can choose a college for Bachelor's of Physiotherapy, which is a 4.5 year course where you will be having academic and clinical exposure. Always make sure that your college follows the lines and regulations of a national body. After completing your Bachelor's of Physiotherapy, you can always choose to work independently, have your own clinic, or work in hospitals and rehabilitation centers. However, you can also choose to complete your Master's and specialize in a particular field. It can be orthophysiotherapy, it can be neuro, it can be cardiorespiratory, it can be community, and it can be pediatrics as well. You can choose from many areas of specialization. You can choose from orthopedic physiotherapy, neurophysiotherapy, cardiorespiratory physiotherapy, community physiotherapy, pediatric physiotherapy, and women's health physiotherapy. Now, coming to the specific areas of specialization. Orthopedic and musculoskeletal physiotherapy. This is an area of physiotherapy where you usually deal with fractures, hip replacement surgeries, different kinds of musculoskeletal pains. The next area of specialization is neurorehabilitation. Here, the physios work with stroke patients, Parkinson patients, dementia patients, and spinal cord injuries, and many other neurodeficits. Coming to cardiorespiratory physiotherapist, this is my field, this is where I specialize in. Cardiorespiratory physios usually work in the ICUs and rehabilitation setups where they see patients after major cardiac events, after major cardiac surgeries, pulmonary patients like ILD and COPD, and many different areas of specialization. Coming to pediatric physiotherapy, pediatric physios are usually known to work with children with global developmental delays, children with autism, and many other pediatric conditions. Community physiotherapy and women's health physiotherapy usually deals with serving people at a community level. Sports physiotherapy, this is an area of specialization where physiotherapists help athletes and sports persons to get back to the field after an injury. Coming to the areas of practice, physiotherapists are usually known to practice in physiotherapy clinics, in rehabilitation centers, in tertiary care hospitals, in primary prevention clinics, in corporate setups, in community settings, and in academics and research. The scope of physiotherapy in urban versus rural India. In urban cities, the scope and physiotherapy awareness is at an all-time high. There are many centers and hospitals which employ physiotherapists very proactively. But you should also understand that the demand is also high, the competition is also very high in urban settings. Whereas, as you compare it to rural areas, the need of rehabilitation and physiotherapist is high because of chronic illnesses and lack of infrastructure. So, you can always work as a physiotherapist in both these settings because the demand is very high. Before considering physiotherapy as a full time career, these are some special considerations you should know. The initial salary may not be so high. You have to be constantly upgrading your knowledge. Making a reputation in this field takes time. There are no shortcuts when making a successful physiotherapy career. In short, to become a good physiotherapist, you need these 5 skills. communication, ethics, clinical reasoning, physical stamina, and patience. Who should not be choosing physiotherapy as a career? Do not choose physiotherapy if you want to make quick money. Do not choose physiotherapy if you do not like interacting with patients. Do not choose physiotherapy if you don't like hands on treatment. And definitely do not choose physiotherapy as a backup option. Physiotherapy should be a conscious decision, not a last option. When I chose this career in physiotherapy, I did not realize how powerful this field was. Seeing a patient after a cardiac surgery, performing tasks of daily living, helping them with climbing stairs, making sure they reach their milestones gives immense pleasure. A career in physiotherapy has taught me resilience, empathy, and patience. It is not just exercise, it is restoring confidence. Physiotherapy in India has immense scope, but only for those who are willing to put work in it. If you are someone who believes in healing people through movement, then physiotherapy is the career for you. Choose physiotherapy not because it's available, choose it because you're committed to it. If you find this video helpful, please share this video to someone who might be interested in pursuing a career in physiotherapy.